Good morning, everyone, and welcome back. We hope you all had a chance to make connections during our networking break, sponsored by Blueprint Medicines, and checked out our exhibitor pavilion, sponsored by PRA Health Sciences. You are all joining us this morning in Track 1, Owning Your Future with a Rare Disease. My name's Robin De Leon, and I will be your breakout host for this morning's session. I would also like to welcome those of you joining us remotely through the live stream, and would like to remind everyone that you can interact with us by using the live Q&A feature on the mobile app. Making the decision to start a family can be very complicated, even without a rare disease. But when you have a rare disease or even a carrier, this topic can be even more stressful. Our speakers today will share with you how to start the discussion of family planning and what options do we have today for those with genetic and hereditary conditions in this session, family planning, decisions, and considerations. Let's welcome Taylor Kane, founder and president of Remember the Girls. Hi. Carrie Estrella, executive director of Little Miss Hannah Foundation. Yay! And Allison Goetsch, genetic counselor at Ann and Robert Lurie Children's Hospital of Chicago. All right, your turn, Taylor.
My passcode's 2030. I know. She's posting to my stories for me, and she got logged out, so, okay. Hi, everyone. My name is Taylor Kane. I'm going to be talking to you today about family planning, of course, but from the perspective of a young adult carrier. So, some personal background. I'm 21 years old, finally. I am a senior at the George Washington University in Washington, D.C. I'm studying political communication and women's studies. I'm originally from southern New Jersey. I say southern because there's a massive difference between being from north and south. And my Myers-Briggs personality type is an ESTJ, if anyone is into that. I think it's important to mention. So my rare disease background, or why I'm here. My dad was diagnosed with adrenoleukodystrophy in 2001, and he passed away in 2003. ALD is a rare neurological disease that destroys the white matter in the brain, and still today there is no effective treatment or cure. It either comes on in early onset or late onset. My dad was, of course, a late onset case, and it is an X-linked recessive disease. So at the time that my dad was diagnosed in 2001, we learned that because of the inheritance pattern, this made me an obligate carrier of the disease since it's passed along the X chromosome, and since I'm a female, I got my dad's X like 100% since he has one X. That makes sense. And then here's just some pictures of me when my dad was sick. In the span of 2 years, he lost the ability to walk, talk, swallow, understand the world around him. So yeah, I would always lay with him in his hospital bed, and I would help feed him before he needed a feeding tube. And so my mom always let me be around my dad when he was sick, and that's something that I really appreciate because I know, you want to shield children from scary things, but I'm really glad that my mom gave me the time that I had with my dad then before he passed away. So learning about my carrier status, as I mentioned, we knew that I was a carrier back in 2001 when I was 3 years old, so I've kind of known as long as I can remember. Like, there wasn't a moment where I remember being sat down and told, like, you are a carrier of ALD and this is what it means. I'm gonna talk more about what it means in the next slide, but when I was 13, my mom took me to see a genetic counselor and some of my dad's doctors at the Kennedy Krieger Institute in Baltimore. And I mean, at the time I was 13, so I was kind of like angsty, like whatever. But looking back, it was definitely a really valuable experience to talk to a genetic counselor and kind of really hone in on what being a carrier meant and what this meant for my future. And then once I entered high school, I started to think more about what being a carrier meant to me, and I wanted to talk to other younger carriers my age and see how they felt about it. So I joined like a bunch of Facebook pages for carriers, but since a lot of the carriers in those groups were much older, they were moms, I was kind of in a different position, and even though we do relate on a lot of issues, I didn't want to like post in this carrier group and be like, hey guys, I'm 16, like should I tell my high school boyfriend that I'm a carrier? Like, just I felt like my issues were kind of trivial in comparison to what some of the other carriers, especially those that were caring for their sons with the disease were going through. So that's why I founded a support group for young ALD carriers in 2014. It was for the ages of 16 to 25, which has now been raised to 30. But I still run that, and there's over 200 members. So we talk about all types of carrier issues, but it is definitely more geared towards the issues that affect like young adult women. And then in 2017, I founded a nonprofit organization called Remember the Girls, which brings together carriers of X-linked recessive disorders, which I'll touch a little bit more on. Okay. So what it means to be an ALD carrier. So I kind of see this in two different categories. So the first is physical symptoms and the psychosocial side effects. So in 2001, it wasn't really known that carriers could develop symptoms of the disease. There had been no research done on it. So when I was told of my status, they told my mom, like, all she has to worry about is passing the gene on, like she's not gonna be affected because, carriers were thought to kind of just be like a vessel, a body just carrying the disease with the ability to pass it on. But today, we know that over 80% of ALD carriers eventually do develop physical symptoms of the disease, which can range from mild to moderate to severe. And this is the same with a lot of other X-linked recessive diseases, but there's not much research still. There's no treatments for carriers. The only preventative measure that I know of that I can do is yoga. So might want to, if anyone is good at yoga, I would definitely appreciate that because I'm not very flexible. But for me, the future has always been really uncertain, not knowing how my carrier status is going to affect me having a family, going to affect me finding a husband, and then of course the entire side of I could develop symptoms, and those symptoms could be very embarrassing, like bladder dysfunction, bowel dysfunction, there's a lot of unknown things in the future, so it's definitely pretty uncertain, and I think that's something that affects a lot of carriers, not just young carriers, but that's definitely something that's played a big role as I've grown up and in the shaping of how I see my future. And then for the reproduction side, so regardless of my partner, so there is a 50% chance that I would pass the gene on to any children that I have. So if I had a boy, there would be a 50% chance that he would have ALD, and if I had a girl, there would be a 50% chance that she would be a carrier. So there are a lot of different options for someone in my position, thankfully. Some people, can choose to have children naturally. You can also do alternative reproduction. There's adoption. And honestly, no one option is best. It really, I think, comes down to the individual, the family circumstance, the financial circumstances, because some of these options can be quite expensive. So I think it's really not black and white. I think, what you want for yourself and what someone thinks you should have, that doesn't have to meet. And I really think it's a very personal decision. Okay, so I will be talking about charting my course as an ALD carrier, going with the Global Genes theme. This in the background is an article that I wrote a few months ago for The Mighty called Why I'm Forced to Consider My Genes as I Think About Marriage and Kids. Don't look it up yet though, because I don't want any spoilers, but if you are interested in reading that, there it is. Also, disclaimer, because I see everyone else including this, my opinions are not representative of my organization, and of course I'm not discrediting any woman or person's decisions about marriage and having children in the rare disease community or just generally. Okay, so first, going into romantic relationships. So of course, the big question is, when do I tell my partner about my carrier status? That's something that a lot of people in the rare disease community, whether they're a carrier or they're a patient, faces. So for me, I have been very public about my carrier status on social media. I post about it a lot. I write articles about it. So pretty much any guy that looks on my Facebook page will know that I carry a disease. They might not really know the intricacies of it, but they know. So I don't really ever have to face like when to tell, but I do kind of have a pressure like, okay, I know they know and I should talk about it, but it is kind of hard to know when. I was talking to Mindy earlier, and I was saying, since I'm 21, say I go on like a Bumble date or something, am I supposed to on the first date be like, by the way, if I have kids, I would have to do alternative reproduction, and then the guy would think, she thinks we're gonna have kids? Like, I didn't think the date was going that well, And it's a hard balance to want to tell as much as you can at the beginning, and then also kind of not to scare the guy and think like, okay, she likes me a little too much. But anyway, yeah, so that's definitely something that's difficult, especially being a young woman still in college. And something I've always worried about too is that I always thought that alternative reproduction could kind of be a deal breaker for some men, like just the fact that, you know, I am not personally comfortable with having children naturally and that I would be doing alternative reproduction. I thought that that could potentially, you know, affect my relationships and affect someone wanting to be with me, you know, because 1, it can be very costly, 2, it's not always successful, and 3, there are, of course, a lot of moral and ethical concerns and considerations. So everyone has a lot of different opinions and beliefs, but I always did think that it could potentially be a deal breaker between being with someone and not. Also, I've just had a fear that my carrier status will just kind of get in the way of my relationship, especially because I do have a lot of uncertainty about the future. I don't have a lot of answers, so whoever I was dating would kind of just be coming on this ride with me, and I always was kind of stressed at the thought of that. And this has led to kind of a lack of enthusiasm about marriage. I write about this more in my article, but just all through high school, I remember like my friends always saying like, oh, I can't wait to have a wedding, I can't wait to be a mom. And I could never envision myself doing, like I could never just imagine it in my mind. And I just wondered like, why don't I want this? And I think over the years, I realized more that I have all these fears that I've been hiding inside about the future, and that's affected my outlook. And now that I realize it and I'm aware of it, and I know, I'm glad, but I'll talk about that a little more later, but I go more in depth than that about my article. Okay, so then for having children, so I made the decision long ago that I would not be conceiving naturally, that if I do have kids, I will be doing in vitro fertilization with pre-implantation genetic diagnosis, or IVF with PGD. Many of you have probably heard of it. I always knew that this was a mentally and physically grueling process, and that, you know, it could be very costly. It's not always covered by insurance. You know, there's a lot that goes into doing IVF with PGD, and the stress that it doesn't always work the first time, the second time, the third time, et cetera. Allison is going to talk a little bit more about the specifics with IVF with PGD and other reproductive options later, but I've always known that that is the choice that I would go with if I do have kids one day. So I also, of course, as I mentioned, have a bit of an ambivalence towards having children. And I'm often asked, whenever I speak on carrier issues, I will have someone from the crowd, it's usually a guy, but they'll ask, like, so are you gonna have kids? And I just say, I don't know. I'm 21 still, and I just don't know. And I'm ambivalent, and I'm okay with that. I've always also been very independent and career-oriented, so that might play a role in my ambivalence, but of course I do have to consider the fact that, you know, I have this genetic condition that I carry, and that affects my outlook about the future. But thankfully, I know that if I do change my mind one day, I have methods to ensure that I have biologically healthy children, and that I have a lot of resources to turn to. So I have a few minutes left, so I'm just going to touch on the future. This is a quote from my article, and I just wanted to read it because I think it really encapsulates everything I'm talking about. So it says, I know the right man should accept me for who I am and what I am, and that no one's perfect. But to this point, it's been hard enough to find someone who is even somewhat accepting of my stubbornness, impatience, and sometimes argumentative nature. True. How can I expect someone else to wholeheartedly embrace my defective genes? So, especially at this point, as I've gotten older and about to graduate from college, I know that I will have to face my apprehensions head on. But as for now, I'm comfortable resting in my ambivalence and not really knowing what I want, not really knowing what the future holds, but knowing that if I do change my mind, you know, there's resources there. I'm involved in a lot of carrier support groups. I've met a lot of great carriers of ALD and other diseases, and of course, everyone in the rare disease community. And I think all in all, when reflecting like on this experience, I feel like being a carrier has taught me that my value as a woman doesn't lie in what my body can create, but the person that I can become. And I think that's been really an empowering thought. And carrier advocacy empowers me, it makes me feel hopeful for the future, and I found so much passion in what I'm doing as a carrier advocate and as a rare disease advocate. And when I think about the future looks bright. I also included my favorite quote by Jack Kerouac. It says, "I saw that my life was a vast, glowing, empty page, and I could do anything I wanted." Okay, that's all. Thank you.
Hey guys. My fan club over there. It's because we have the same name. My name's Carrie Austria. I actually have a ton of roles here in the rare disease community, like many of my friends and colleagues here. But most importantly, besides being a rare disease advocate, a foundation, nonprofit leader, I am the very proud mom to 3 kids. And that, to me, being a wife and mom is probably one of my favorite roles. And when I was asked to kind of share my story, and I apologize, I don't have slides. I'm kind of a last-minute replacement. And they're like, "Hey, Carrie, do you want to share your story?" It's like, me talk about my kids and this world? Hell yeah, you know. So I wanted to share a little bit about my story on how I kind of, how the whole family planning for us and the discussions are kind of still evolving into our life, as I now have my oldest as a college freshman, which living his best college freshman life. Yeah, that's a great part of parenting. So a little bit of history. My husband and I, we've been married 20-something years. And we met and we got engaged very quickly. We planned our honeymoon literally on our first date at Magic Mountain, California. We met at a bar like the week before, and we got engaged in Las Vegas 2 months later. We are still happily married after 22 years. He's still my best friend, best decisions I ever made. However, saying that, if anybody tells me that they're engaged after 3 months, I am the biggest hypocrite. It's like, you really need to think that one through. So that being said, one of the first things when we got together, building a family was so important to both of us. We both had a younger brother. Just, having kids was always part of the plan. As a matter of fact, we had moved in with each other a few months before we got married, and we decided to go off the pill, right? And our biggest worry was, what if we get pregnant before the wedding? People are going to do the math and say, oh, so maybe they got pregnant before, right? So that was like our big worry for 2 months. Didn't have to worry about that, it turns out. What ended up happening is we ended up on a 4-year infertility journey. It turns out I had a polycystic ovarian syndrome, which I know is a pretty common cause of infertility, which means you make too many follicles. So we went through 4 years of infertility treatments, 9 different treatments, including 5 artificial inseminations and 4 in vitro fertilizations. And this was before the days of PGD. If that was available, life would be completely different right now, but I'm not going to change anything. So we ended up with 5 early miscarriages before 9 weeks, so it wasn't anything that we got really attached to. Looking back, it's easy to talk about now. But it was really hard for us because we put our whole heart and soul in creating our family. We didn't have any knowledge or reasons why this was happening outside of it possibly PCOS. So we went to UCLA, which was near where we lived, to get some testing done. Again, this was almost 20 years ago, so things have changed a lot. They still couldn't give us any answers. So we decided to adopt, and we brought home our son Ethan from Russia 6 months later at the age of 1. Cute little blonde-headed toe kid who is like the most adorable little thing. And yes, I have a blonde-haired, blue-eyed son, and my husband and I are both dark hair, dark eyes, and nobody even questions it. So a lot of people don't understand genetics, obviously. And we still wanted to build our family. We loved it. We loved having Ethan with us. We brought home Abby from Russia 3.5 years later at 6 months old. So we were done. We had our family. We're like, you can't have an oops adoption, right? So we were done. So you know that old adage about once you adopt, you get pregnant? 4 years of infertility, couldn't figure this out. Adoption did. We ended up pregnant with Hannah. That cute little girl, isn't she adorable? And it was kind of funny because I remember I was really sick, and I'd never been pregnant long enough to have, morning sickness. So we thought I had the flu. My daughter, who was 2.5, is like, "Mommy, you're probably pregnant," because our friends are pregnant. I'm like, "Cute, honey. You're so cute. Go play with your wiggles." And my husband looked at me. He's like, "Really? Really? Maybe?" And so we went. He went to the grocery store, picked up a pregnancy test, and we both were like, "Shit." It's like, this was not part of our plan. And I remember just sitting there. It turned out we were 9 weeks along when we found out. So it was past any pregnancy we'd had before. And just I get very tangential, especially when I don't have slides, so I apologize in advance. I remember going to the OB, and to get, you have to get it confirmed by an OB because it's not real unless they say it is. And I just started busting out crying, laughing when they're like, "Yeah, it is." I'm like, "Oh my God, my husband's gonna kill me." Just like totally being like, oh, because we just were in shock. And I remember the doctor coming in, he's like, "Do I need to call the police? Do you need police protection? Is your husband really gonna kill you?" So by the way, you ever say that at an OB's office and get hysterical and say your husband's gonna kill you? Just jokingly, they take it serious. Anyways, so the pregnancy went along fine up until about 29 weeks. All of a sudden, I developed extremely high blood pressure and other pregnancy complications, not related to anything other than being an older woman. And so they encourage you being older. I was 39, so don't do the math. 39 at the time, and they have you do all those testing on, the baby for Down syndrome and any other common things. Scared to death about that. Did the testing, everything came back normal. So we went on with the pregnancy. About 34 weeks into the pregnancy, they keep doing the ultrasounds. And it looked like, we knew it was a girl. We already had named her Hannah. She had a big abdomen. So, nobody thought anything about, we're like, "Oh, well, we got a big mama, big daddy, maybe big babies already starting out early." So nobody questioned the big abdomen. Looking back, that was our first clue. Nobody caught it. She was born, and we had one good medical day with her. The second day, she became jaundiced. Her abdomen was really big. Her platelets were at 6,000. So they were really worried about brain bleeds, and they whisked her off to the NICU on the second day. And I remember the second or third night, Robert was spending the night with me, Robert's my husband, in the hospital because I had a C-section. I had a little bit of a complication from that. And the nurse came in, and they had brought Hannah back in temporarily for something. And she was sleeping with us briefly. And I remember hearing the nurse say, "Well, she doesn't need a kidney," to another nurse. I woke up panicked and all this, and Robert's going outside chasing after the nurse. It's like, what the hell? It's like 2 a.m. What the hell's going on? The doctors aren't telling us anything. They're just monitoring her. Long story short, fast forward, 2 weeks in the NICU, turned out she had an enlarged spleen, which is the first sign that we knew she had some kind of disorder. All the testing they did, they couldn't figure it out. She was the most healthy baby in the NICU. I mean, she had IVF or IVIG transfusions, blood transfusions. She had like 50 needle sticks for blood work. They did everything to try and find an answer. But she was really kind of healthy. We got her platelets up to like 45,000, which is not great. But we're like, she's 2 weeks old. You're not doing anything. You're not finding answers. Can we take her home? We lived in Houston at the time, so we were connected with Texas Children's Hospital, which is probably one of the best places to be living because they have a phenomenal pediatric genetics program. So we're like, let us take her home and we'll do outpatient. We'll go there every day if you want, we'll do whatever. So they let us take her home, so we got to start being a family of 3. The kids started doting on Hannah because she was a typical newborn, doesn't do anything but eat, poop, and sleep. And it was awesome. Even though we still went to Texas Children every once or twice a week, they were still trying to find answers. Finally, at about 5 months, my husband actually noticed that Hannah's other side was getting bigger. The spleen is one place, and then there's another place for the liver. And so we went and back to our hematologist. It's like, they did an ultrasound of her liver. Yeah, her liver's getting bigger. So what does my husband do? Dr. Google. Enlarged liver, enlarged spleen, low platelets. First thing that pops up was Gaucher disease, which is an ultra-rare lysosomal storage disease. And I know we have some LSD families in here. It's not a drug. And you say LSD to somebody who's not in the lysosomal storage disease group, they look at you like you're talking about drugs. That's why I say that. And so Robert's like, look, it could be Gaucher. Can we test her for it? So they did a blood test. Came back that she could be a carrier. She didn't have Gaucher disease. So we started looking at other lysosomal storage disease like Niemann-Pick type C and Tay-Sachs and the other related ones, because that was kind of the profile she was presenting. And long story short, she ended up having Gaucher disease. She has one of her mutations, because you need 2 mutations. Robert's mutation is this very obscure mutation from Sweden. So she did have this rare genetic disorder, and they gave her 1 year to live. So that's when I became an advocate. And so that kind of came our whole journey. Within 3 years, she went from being a special needs child to being a medically complex child, to being a medically fragile child, to being on hospice. And that was kind of our life journey with our rare disease space. However, saying that, the reason I wanted to share this story with you is because right now Ethan is, like I said, a freshman in college, living his best college life. Every typical thing a college kid does, he's doing it, including asking for money and FaceTiming his sister drunk at a party. Abby is a sophomore in high school. She's about ready to drive. And to me, and I know you're going to talk about PGD and other options, we tried everything. We did the IVF, we did the artificial insemination, we adopted. And my leaving message for you guys is, it doesn't matter how you start your family. It is the smiles, it is the phone calls from the police at 4:30 in the morning telling you your son is at the park when he snuck out of the house. It's hanging out on your bed talking to your teenage girl about the tea, which for those of you who don't have teenagers, that's gossip. I'm educating everybody here, at least today. But really think about, if you already have a child or you have a predisposition to a genetic disorder, don't just think about the medical science of it, think about your family lifestyle. Having a special needs child was one of the best gifts in my life. I had a child who couldn't speak verbally, but she had more to say than any child. She gave unconditional love. Our whole family, if you ask Ethan and Abby, even today, what it was like living with Hannah, they will have nothing but good things to say. And they had a full year of living with nurses, emergency rooms, they had the whole gamut. Create your family based on what you know, and everything else will fall into place. There's so many different ways to create a family. If you know what to expect, and this is for you too, as your other mother, you balance what you know with what the life you want to live. And there is a balance. There's like a fine line. She's got like 7 or 8 of us, yeah, I think. We just all want to adopt Taylor. But it's not just the medical side of things. It's your lifestyle. It's your financial lifestyle. Looking back, Robert and I made the biggest mistake of going broke on infertility treatments. And now, these days, it would include PGD and other alternatives. Think about how that affects your family. Obviously, I'm a huge proponent of adoption because to me, it does, adoption in our house is kind of like the sky is blue, you're adopted, the ocean has waves, it's not a thing. Some families, it's a much more sensitive issue, and I'm not one to judge. To me, it's really being honest with yourself on what your capacity is to handle your emotional lifestyle, your social lifestyle, your medical lifestyle. Like I said, I wouldn't give up being a mom to a special needs child. And I have learned so much more about myself as a person. Would you guys believe, especially for my friends in the room, would you believe that I was a very shy person who did not like talking to people and who would be in the back of the room just kind of being the wallflower? Not anymore. Hannah completely changed my life. She brought in a whole new world. So as Allison's going to kind of explain more of the options and opportunities, because there are so many opportunities for you to create your family planning, I just implore you and encourage you to just think about all the good that comes out of every decision you make. And at the end of the day, the hugs and kisses and the yelling to go clean your room, it's all worth it, whether you do adoption, natural, PGD, but just consider everything as you kind of go into planning your family. So thank you, guys. And now you get to tell them how it really is. Do this.
All right, well, hi everyone, I'm Allison Goetsch. I'm a pediatric genetic counselor at Lurie Children's Hospital in Chicago. I'm extremely excited to be back at Global Genes and really honored to be up here with Taylor and Carrie. I think that their stories articulate exactly why I am a genetic counselor. It's to be with families and individuals as they're making these decisions. All right, so we're gonna be talking, oh, there we go. A little technical difficulty. We're going to be going through the various family planning options that are currently available. I do want to let you know that things that we're talking about today are rapidly evolving. So there is something I'm going to bring up that just a few months ago, I gave a very similar presentation, and I couldn't say that this existed. So things are changing very, very quickly. And I also want to talk about how you can work with a genetic counselor and your healthcare providers to make your family planning decisions. So as we've all heard, there are many, many different ways to have a family, and there really is no right way. It's just what is best for you and what is best for your partner and your future family or your current family. So we're going to go through options that are available if you conceive naturally, options that are available with the use of assisted reproductive technology, including using sperm and egg donors, as well as surrogacy and adoption. So the very first thing when thinking about, do I want to conceive naturally, and do I want to consider any genetic testing or genetic screening during a pregnancy, is to ask, how would I feel if my child also had the condition that I have, that my partner has, that one of my existing children has, one of my family members has? What would this make me feel? And would you want to know if your pregnancy had this condition? I think a lot of people, when the topic of prenatal testing comes up, they think, oh, it's just an option if you're considering terminating a pregnancy, but it's not. That's one thing that you can do, but you can also use prenatal testing to plan and prepare for having a child who is affected with a very serious health condition. And if you do testing and your results are negative, that can significantly reduce your anxiety. So I think there are more than one routes to go with prenatal testing. If prenatal testing is not, and screening is not something that you think you would want to do or you and your partner would want to do, there are alternative ways to have a family. So we'll go through the details of IVF, we'll go through the donor egg and sperm options and adoption. And I also just want to highlight that some individuals may have a health condition that makes it unsafe or difficult to be pregnant, and so surrogacy may be a safer way to have a pregnancy. So first of all, if you or your partner decides to become pregnant naturally, there are two different prenatal testing options. And I'm sure people have heard about these before, so I don't want to spend too long on them, but they're very similar to each other. The first option is something called chorionic villus sampling, which can be done as early as 10 weeks into a pregnancy. So it's done in this period between week 10 and week 12, where a needle is inserted into the abdomen or through the cervix to remove a small piece of the genetic material from the placenta. The placenta and the baby have the same genetic makeup, so we're able to test that to see if the pregnancy inherited the genetic condition. Because it's an invasive procedure, there is a small risk of miscarriage. It's about 1 in 200. And so that is something to weigh when making this decision. And this testing would be diagnostic. So it would be a yes or no answer. The pregnancy has the gene changes or the pregnancy does not. The other option is a little bit later into pregnancy, so as early as 15 weeks, you can consider amniocentesis, which is a similar procedure. A needle is put into the abdomen, and the fluid, the amniotic fluid around the baby, a little bit of that is removed. And just like when you're in the shower and you're washing with your loofah or your washcloth, some of your skin cells are coming off. And babies are losing skin cells inside of the amniotic fluid, so we're able to test the genetic information from the amniotic fluid. Because it's a little bit later in pregnancy, an amniocentesis has a risk of miscarriage about 1 in 900. It's not that it's a safer procedure than a CVS, it's just that the further along you are into pregnancy, the lower the chance to miscarry. And this is also diagnostic. For both of these options, you do need to know what the genetic cause of the condition is. So for someone who has uncertain genetic test results or who has not received a genetic diagnosis, these unfortunately may not be available. There are also screening options. So some people say, I don't want to have an invasive procedure for many, many reasons. Often it's that they wouldn't consider termination or that they're worried about the risk of miscarriage. So some families decide, let's just do a screening test. And as early as 10 weeks into pregnancy, you can screen maternal blood to see if there are differences in the free DNA that's floating around. So everyone has DNA that's outside of their cells in their blood. And a little bit of that DNA from the placenta is in mom's blood too. So we can actually look at mom's DNA and baby's DNA to see if there's an increased risk for a genetic condition. This is not a super invasive test because it's just a blood draw. So there's no needle going into mom's abdomen or cervix. And it can screen for a variety of conditions. So this first became available several years ago as a way to screen with increased sensitivity for Down syndrome, trisomy 18, trisomy 13, and then they were able to also look for presence of Y chromosome material to let families know if there was an increased risk of an X or Y chromosome disorder. And as this technology evolved, they began screening for chromosome deletions and duplications. So for things like Cree-Shaw, Williams syndrome, Wolff-Hirschhorn syndrome. And then as of a few months ago, there is a company that is offering this type of screening for inherited genetic conditions. I think they are here at the conference. Their name is Progenity. And what they do is before you're pregnant or early in your pregnancy, they get blood samples from mom and dad and possibly the child, depending on what condition it is, and they let you know, is this even an option? And if they feel like it is an option, they'll design a special test that they can then do this blood draw at 10 weeks and look to see, is that gene change or those gene changes found in the fetal blood or fetal DNA? That option is not currently covered by insurance, so it is $2,800 for families, so it's not something that's available to everyone, but they do have payment plans. And if you're interested in that option or you know someone is, who I highly, highly recommend discussing it with a genetic counselor before someone is pregnant. And I just want to reiterate that this is a screen, so it's not going to tell you yes or no, it's just going to tell you if there is high or low risk. So moving on to assisted reproductive technology, I'm going to talk about preimplantation genetic testing, which up until recently was called preimplantation genetic diagnosis, but they have since decided to make everyone's lives difficult and change the name and make it several categories. So this has been going on since 1990, and it continues to get better with each year. So you can screen for differences in chromosome number, you can screen for chromosome changes like extra missing pieces, and you can also screen for single gene disorders. This is performed in conjunction with in vitro fertilization. So mom is given hormones to stimulate her ovaries to make many, many eggs. We then go in and remove those eggs. Dad has the easy job, he submits a sperm sample. And then in the lab, we fertilize the eggs with the sperm and then test the embryos to see if they have the genetic condition before implanting them back into mom. So we'll take a closer look at PGT. Here you can see the egg retrieval. And then here we see that that single egg is being fertilized with a single sperm. And then after a few days, they're able to remove a cell from the outside of that new embryo to test it for the genetic changes. This is unfortunately very, very expensive. So the average cost per cycle is between $17,000 and $25,000. Some states do have insurance coverage for in vitro fertilization and preimplantation genetic testing, but most of the legislation that is out there is specific to infertility. So if you are doing this and you have normal fertility, you may have no coverage. You may be able to get partial coverage. And each state's law is a little bit different. So I do recommend, if this is something you're interested in, is going to the National Conference for State Legislatures website to see what your state specifically covers and does not cover. So some families may decide to use a donor egg, donor sperm, and this may be because it is a less expensive option, or it may be that they're not wanting to go the IVF and PGT route, so they don't want to test embryos. So sperm donation is the more affordable of the two. The average cost to use a sperm donor is around $4,000, and egg donation is still pretty pricey. So if you use a frozen egg, it's around $14,000, and if you decide to select your donor and go through an agency and have a fresh egg retrieval, it can be just as expensive as doing the in vitro fertilization with PGT on your own genetic information. And then for those who maybe cannot safely carry a pregnancy and want to consider having a surrogate with their own egg, a donor egg, with their own sperm, donor sperm, they may want to go the surrogacy route. This tends to be rather costly. Based on my research, I found that it begins around $95,000, so it's really not necessarily accessible to the vast majority of people. So adoption is a great option to expand families, but it's also very pricey. I'm sure Carrie would be happy to talk to anyone about that. I think it ultimately just really varies the route you decide to go, whether it's an international adoption through an agency, or an adoption through an attorney. As you can see from my chart that I've created with the most recent prices that are out there and published, going through the foster care system is much more affordable. So it's only around $3,000, and that's a great way to give a child who needs a home, a family. And there's a wonderful organization out there who does adoption surveys, and they were trying to figure out, how do families afford this? And I think that this doesn't just apply to adoption. I think a lot of these things can apply to going through IVF with PGT, considering a donor, considering surrogacy. But just looking at this list, people make this work. It's a scary thought financially, but I don't want that to hold anyone back from looking into it. So I would encourage you, if you're interested in any of these options, to reach out to others who have been through it, reach out to the reproductive specialists, and just see, is this something that's feasible for me? So just to quickly review, we talked about screening in pregnancy using cell-free DNA. We talked about diagnostic testing with CVS and amniocentesis. We discussed the assisted reproductive technology options available using in vitro with preimplantation genetic testing, sperm and egg donation, surrogacy, and adoption. So how do you find a genetic counselor so that you can learn a little bit more about your options that are specific to your family? If you don't already have a genetic counselor, I would encourage you to go to the National Society of Genetic Counselor website and use their Find a Genetic Counselor tool, and then reach out to someone. I think that you'd be surprised on the various roles that we can play. Even though I'm a pediatric genetic counselor, I work with my families during their family planning as well. And it may involve not just me, maybe a colleague of mine who is at an IVF center or who's at an OBGYN office. But we are a valuable tool, and if we can't help, we can definitely help get you to the right person. Thank you.
Great session, wasn't that? So does anybody in the audience have a question for our speakers?
Hello. I'm wondering how far ahead someone should start this process with a genetic counselor. Say I'm thinking about this in 5 years. Is that something I should start doing now, or wait till I'm more ready to actually have kids?
It's a great question. So I don't think it's ever too early to start this process, because I talk about this with my teenage patients all the time. It's actually one of my favorite parts of my job. But I would encourage you to seriously consider meeting with a genetic counselor or calling your existing genetic counselor to have this discussion when you're thinking within the next year or so, I want to start having kids. Especially if you do not have a genetic diagnosis. So I work with a lot of individuals who maybe have a clinical diagnosis of a genetic condition, but they've never had the testing. And we have to test that person first before we can consider some of these options if they want to go the testing, screening, or assisted reproductive option route. So that process can be lengthy, working with insurance, the time it takes to do testing. So about a year is a good time, but it's never too early.
And also science is changing this so fast. What we know today, like you said, in 4 years when you're suggesting, it's going to be, there's going to be so much more information out there that's not available today. That's easy.
She's going to get you.
Hi, I just wanted to thank Allison. I've gone to a lot of reproductive sessions over the years, and this was by far one of the best I've seen. I really appreciate you sharing all of the options and making sure that families hear that they're supported in whatever decision they make, and that there are options out there and that they can be supported, and you have to make the decision based on whatever's right for your family. And then also in response, in response to some of the questions on the carrier, I just wanted to share that, that's something that I felt obligated to do. I'm a carrier myself. My son is 19 and has a rare disease. And as soon as we were able to identify what rare disease he had, I made sure to share all that information with my family members. And something that I had to finally be okay with was that it was their decision to do what they wanted with that information. Some of them still feel it can't happen to me. And I have to just know that I did my part in sharing that information with my family members. And I don't think I agree, it's never too early to start looking and planning.
Hi, I'm Mindy Cameron. I'm a carrier of DMD, Duchenne Muscular Dystrophy, and I'm a board member of Remember the Girls with Taylor. And I just wanted to say thank you. These issues are so important. My own health has been affected as I got older by my carrier status, and it's so important to know and to make sure your doctors understand, because a lot of them don't. A lot of people really don't understand that carriers can have health issues themselves. So never take no for an answer, and because I know I'm a carrier and because I'm on medication for my symptoms, I don't really anticipate that it'll shorten my life, but it's I think it probably could have if I didn't know.
Thanks. Yes, Queen.
Hi, thank you so much for speaking. I'm a medical student, so I'm thinking ahead to the future as I'm a physician. I'm wondering, like in primary care, OBGYN, how much of a discussion a physician can have with their patients versus like referring them to a genetic counselor. Like as a patient, how would you feel?
Well, having been out of this for a little while, I think one of the things that physicians fail to miss is the opportunity to educate and empower their families with information to get them started. So I do think it's always important for a physician to find a way to get that family support. To me, genetic counselors are the unsung heroes of the rare disease world. I've been saying that for years. Those people that know me, I've been saying that for a long time, because I'm recently, last few years, been a very big proponent of mental health support for those of us in this community. And so as a future physician, I would strongly, whether it's a genetic counselor, a child life specialist, some kind of support to give them real life opportunities to understand what the future could hold. That would be my suggestion. So.
I think as a primary care physician or an OBGYN or a specialist, because if you work with someone who has a rare disease and you're their go-to, it's important to be familiar with these concepts, but you don't need to be the expert. And I always think the sign of a great healthcare provider, genetic counselors included, is being able to acknowledge I don't know, and being able to find somebody who can help.
Hi, I have had an organ transplant, and so it's not safe for me to carry my own child. But my husband and I go back and forth about like surrogacy and adoption within, the next few years. As a mom who's adopted, when do you recommend that we kind of set an appointment up just to get informed about adoption options and like what we can do and how much money, we do need to have and just like all the information about international versus adopting domestic and everything. And then the other thing is, I guess the second part of my question is for surrogacy. I think as a patient, I have a lot of like OCD because I feel that it's kind of ingrained in me because of like the responsibility of medications and like sorting everything and being clean and everything. And so with surrogacy, my issue is that like having somebody carry my child, I want to control everything about the pregnancy, including like what the person does and what they eat and everything, which I know is not healthy. But I really struggle with that. So can any of you guys give like your input on how you think that I would be able to do surrogacy in a more healthy way?
I'll let you talk about the surrogacy side.
I think it's hard for anyone to use a surrogate, just the emotional factors involved in that. And you have to relinquish a little bit of that control, but you certainly work very closely with an attorney during the surrogacy process, and you can put some crazy things in your document for your surrogacy agreement. So I think just making sure that you have someone to talk to, that not just your family, your partner, your friends, but having a mental health provider in your life is great for everyone. Huge advocate of that. I think everyone should see someone at some point, if not forever, so that you can just be more comfortable with the process.
And as for the adoption side, what I didn't share in my story is we also had a failed domestic attorney adoption in between Abby and Ethan. Reason being that Russia had closed when we were looking to adopt again, so we decided to try domestically. So we've done all the routes, it seems like. For the adoption side, for us, the international worked for us because I am like ancestry DNA proven 100% Eastern European. So for us, Russian Poland was like the perfect match for us, and my husband's a mutt, so anywhere would work for him. But for us, the international adoption for Ethan, it literally took us 6 months because in Russia, there's so many boys. However, for our second child, we wanted a girl. It took us 2 years. It was like having an elephant child, and we actually had started at another country in Georgia, which ended up when the paperwork was in Georgia having a coup, and Georgia adoptions were shut down, so we went back to Russia when it was finally reopened. So international is a lot more tentative because you have less control. So I would take a little bit longer on studying not just what's happening now, but like the past 3-5 years of political. There's a lot of political with international adoption, whereas domestic, it's a lot more straightforward. It's just you're dealing with a lot more personalities. That being said, looking back now that my kids are my kids, I don't care if they're my blood or not, it doesn't matter anymore. At the time, I was very much, we're kind of like, we wanted a closed adoption. We didn't want, our kids with this other family. Now that they're here and they don't care, which is interesting, they're not interested in learning their history, but I care now. I kind of wish that there was that open conversation, that we knew who they were, mostly for medical reasons, because now that I'm in this whole space, it would be nice to know if Abby or Ethan have a predisposition to something. But that would be kind of some of the considerations I would look at. Domestic is, and I, for those of you who have done domestic, I give you a lot of credit. It's more of a crapshoot because you have to get a really quality lawyer. You have to be matched. We were matched with a woman for 2 months, and 2 days before she changed her mind. So it was kind of like you invest all this into a person that you know, and it's a lot more emotional. Where international is much more, it's less emotional, but more taxing, if that makes sense. And if you ever want to talk adoption, I am a huge advocate. So feel free to reach out to me and say, okay, Carrie, I'm ready. What do we do now? So.
One more question?
I'm just going to add to that, the comments you made, because I work with Gift of Adoption Fund, and the first thing we say is find the very best agency or lawyer out there that you can possibly work with, who has the child's interest at heart, first and foremost, and consult with them about all the changes that have happened in the adoption world since yesterday,
Yes.
and what would be the best choice for you. And secondly, I would say for funding, there are organizations out there that help with adoption assistance grants. Gift of Adoption is one of them, but there are others as well. And there's a lot of good resources to tap there as well.
So we heard a lot of good stuff. Thank you guys so much for sharing. We want to thank Taylor and Carrie and Allison again for sharing your knowledge and experience with us. And we'd like to ask the audience if they could take a moment to take our quick survey. And coming up next, we have our lunch break, and that's sponsored by Advocacy. And before we head out, if you're more interested in learning about this topic, join our newest educational program, Rare University, Global Gene's first online learning platform. We've recently put out a course on genetics where we will dive deeper into family planning. So I want to thank our speakers again, and one more time, and then we'll see you back here at 1 o'clock for our next breakout.